right. Hello, everyone. Thank you so much for joining us for today's webinar, which is the second session in a collaborative SAMHSA VA learning series entitled Celebrating and Elevating American Indian and Alaska Native Service Members, Veterans, and Their Families. Next slide. I'm Stacy Owens, Military and Veterans Affairs Liaison for the Substance Abuse and Mental Health Services Administration, also known as SAMHSA. One of our initiatives here at SAMHSA is to partner with VA on efforts to support community-based suicide prevention for veterans. Next slide. For those who were not able to attend the first session, I'm going to give just a quick overview of the history of this partnership between SAMHSA and VA. In 2018, our two agencies came together to collaborate. We jointly hold policy academies and other forms of technical assistance to support jurisdiction-based teams in creating and implementing strategic action plans for reducing suicide where veterans work and live and function as members of communities. We know that VA has a strong history of clinical interventions for veterans who receive care within VA, but data also shows us that the majority of veterans who die by suicide have not stepped foot inside a VA in the year prior to their death, which really emphasizes the importance of reaching veterans in communities. Additionally, recent data shows us that suicide rates are unfortunately increasing among American Indian and Alaska Native veterans in particular. So we are expanding our technical assistance with an eye on increasing support for this group of veterans that has an exemplary tradition of service and resilience. Next slide, please. This webinar is being supported by SAMHSA's Service Members, Veterans, and Their Families Technical Assistance Center, which partners with states, territories, and communities to increase behavioral health support for the SMVF community. The TA Center strengthens military and civilian collaboration, provides a centralized platform for jurisdictions to connect and to share, increases awareness of and access to resources for SMVF behavioral health systems of care, and also supports coordinated responses. Next slide, please. The TA Center provides the support through several avenues, including academies for jurisdiction-based teams, crisis intercept mapping for SMVF suicide prevention, webinars like this one, as well as other types of virtual learning opportunities, and connections with experts and dissemination of information and resources. Next slide, please. We appreciate the speakers that you'll hear from today. We also appreciate each and every one of you for taking time out of your busy schedules to celebrate and elevate our American Indian and Alaska Native service members, veterans, and their families. To carry us through the rest of the session today, I'd like to introduce Dean Dufresne. Dean is a veteran of the United States Marine Corps. He's also an enrolled member of the Turtle Mountain Band of Chippewa Indians, and he's really dedicated his life's work to supporting his fellow veterans. We are really fortunate to have him working as a consultant with SAMHSA's SMVF TA Center. And Dean, the floor is yours.
Thank you very much, Stacy. I really appreciate that introduction. Good afternoon, everybody. Like Stacy said, Dean Dufresne here, Marine Corps veteran and enrolled member, Turtle Mountain Band of Chippewa Indians. I'm really honored to be here moderating this and to further on this discussion. Lots of work to be done in Indian country, and we have some expert panelists here to share on how you can go about doing that. Next slide, please. We have a disclaimer here stating that the views, opinions, and content expressed in this presentation do not necessarily reflect the views, opinions, or policies of the Substance Abuse and Mental Health Service Administration, also known as SAMHSA, the U.S. Department of Health and Human Services, and the Veterans Health Administration, or U.S. Department of Veterans Affairs. Next slide, please. Yeah, regarding Q&A, please enter questions for the presenters in the Q&A. The chat box will be disabled for this webinar. The slides and session recordings will be emailed to all registrants following this session. Next slide, please. Today's learning objectives. Number one, to provide an overview of SAMHSA's National Tribal Behavioral Health Agenda. Number two is to describe resources available to promote the mental health and well-being of tribal communities. Next slide. Here to help us today are our presenters that bring us along this journey and provide this expert presentations. We have, we have Captain Karen Hurd of the Choctaw Nation. She's the Director of Office of Tribal Affairs and Policy. We have Commander Jenna Meyer, Public Health Advisor, Office of Tribal Affairs and Policy, and Sienna Hunter Sujay, Shinnecock Nation, Certified Trauma and Resilient Practitioner. I'm just going to give a quick overview of some of their background and information so you get a sense of who they are, where they've been in this space. Starting off with Captain Hurd as the Director of the Office of Tribal Affairs and Policy at SAMHSA. Prior to her work in SAMHSA, Captain Hurd served as the Director of the Office of Tribal Affairs and Strategic Alliances with CDC Center for State, Tribal, Local, and Territorial Support. She also served as a behavioral health consultant for Indian Health Service, where she supported behavioral health programs, providing services impacting more than 410,000 Native American people. She has chaired the IHS National Zero Suicide Advisory Committee and served as a member of the National Suicide Crisis Policy Committee, working to establish the first IHS National Suicide Care Policy. Captain Hurd is a proud member of the Choctaw Nation and previously served as the Behavioral Health Director for the Choctaw Nation of Oklahoma. She led the creation of the Choctaw Nation Windhorse Family Treatment Center, which provides family-centered substance abuse prevention and treatment services. Also, we have with us Commander Jenna Meyer as a public health advisor in Office of Tribal Affairs and Policy at SAMHSA and a nurse in the United States Public Health Service. Commander Meyer spent 8 years working for the Indian Health Service. During that time, she worked in various locations as an obstetrical nurse. You're going to have to help me out with that and clarify that one when you come on. Coordinator for Baby Friendly Hospital Initiative and Director of Quality Management at the Hopi Healthcare Center. She worked for the CDC as a public health advisor, assigned to a regional initiative in Appalachia, Kentucky, and focused on community-led solutions to the opioid epidemic. She also served as CDC Deputy Director for the Office of Tribal Affairs and Strategic Alliances, and most recently led a team of project officers and oversaw a large tribal grant to support COVID-19 preparedness and response activities. In her numerous roles, Commander Meyer has worked closely with federal, tribal, and community partners to advance public health and well-being through collaboration, communication, and focus on preventative practices. Lastly, we have Sienna Hunter Sujay, an enrolled member of the Shinnecock Nation, raised on the reservation located on eastern Long Island, New York. Ms. Hunter Sujay served as a former tribal council member who chaired the governance and election committee that brought the trustee elections back to the territory. She served as a teacher, mentor, leader, and advisor in the community at large. In 2017, she joined the team at SAMHSA Tribal Training and Technical Assistance Center by way of Wopila Consulting LLC, a women-owned small business, as the technical assistant coordinator, where she had the opportunity to work with Native Connection grantees across the country who were working to combat suicide, substance misuse, and address mental health through prevention and intervention. Currently, she works at 3-Star Government Solutions on the SAMHSA Tribal Training and Technical Assistance Center team as the task lead, providing support to tribal communities and tribal governments across the country in areas of mental health, substance misuse, strategic planning, trauma, and crisis intervention. Prior to this work, Ms. Hunter Sujay served as the Executive Director of Tribal Operations for the Shinnecock Nation. During her tenure, she worked diligently to build relationships with other tribal nations, governmental agencies, various organizations, and individuals to enhance the services and programs of the nation. Those are our presenters today. It was a mouthful. I thank you for bearing with me and getting through that. Next slide, please. With that, I'm going to turn it over to our subject matter experts, starting with Captain Carrie Hurd of Resources to support tribal behavioral health. Thank you, Captain Hurd.
Thank you so much. And thank you so much for the invitation to share today and be able to let you all know about some of the resources and fundings that are available to serve American Indians and Alaska Natives at SAMHSA. Go ahead and go to the next slide, please. So I wanted first to share with you a little about funding available at SAMHSA for American Indian Alaska Natives and for tribal nations and tribal organizations. For 2024, SAMHSA had 32 notice of funding opportunities, and 28 of those were available for tribal nations and tribal organizations. We have 4 tribally specific funding opportunities, including resources for tribal nations to improve response for 988 contacts coming from tribal communities and American Indians and Alaska Natives. Also to address opioids and stimulants, prevention, treatment, recovery services. Also youth prevention to help prevent suicide and substance use disorder for youth, and circles of care, which helps develop mental health systems for children and families in tribal communities. We've worked hard to also help increase access and awareness to these funding opportunities. And with that, we've developed a tribal funding page that can be accessed. We've also shared on this slide 3 funding opportunities that are currently open at this time that may be of interest. Go ahead and go to the next slide, please. Now, related to tribal technical assistance, we have robust tribal technical assistance open for tribal nations and tribal communities. We have the Opioid Response Network, and for the Opioid Response Network, you don't have to be a SAMHSA grantee to access it, and it's totally free. The Opioid Response Network has also developed the Indigenous Resource Work Group that are experts regionally in tribal communities that can respond to questions related to opioid and stimulants. I used to be the regional director for SAMHSA in Region 6, and it amazed me the wide kind of array that responses that the Opioid Resource Network responded to. I think like the most grassroots was a grandma that had unfortunately lost a grandchild to opioid overdose that wanted to develop resources in her neighborhood, to large health systems that were developing an opportunity to be able to do medications for opioid use disorder in their ERs. So a lot of breadth and width to this technical assistance, but again, totally free. We also have our Tribal Training and Technical Assistance Center. So the Tribal Training and Technical Assistance Center provides the technical assistance for our Native Connections grantees, as well as a wide array of resources for suicide prevention and substance use disorder. So this is the technical assistance that can also help develop a tribal action plan for a community around substance use disorder. Also, our newly minted American Indian Alaska Native Behavioral Center of Excellence. So this Center of Excellence is just getting stood up. It's at the University of Arizona, and there's going to be a lot to come from this COE. And other training and technical assistance centers, really a wide array that are not just tribally focused, but can also offer a lot of technical assistance available on our SAMHSA website. Go ahead and go to the next slide, please. So we've been really busy trying to uphold our SAMHSA tribal consultation policy. And our SAMHSA tribal consultation policy is our commitment to tribal nations to elicit feedback and outreach before SAMHSA makes decisions that have significant impact on tribal nations. We also wanted to be more transparent about how we were sharing the feedback that we received, and then how this feedback impacted our actions related to different issues, programs, initiatives. So we've been busy on this slide. It's representative of the multiple listening sessions that we've done. I think the National Strategy for Suicide Prevention was our most recent session, and we've just now published the summary report, and then a Dear Tribal Leader letter sharing how the feedback that we received influenced the NSSP. Also, we recently did tribal consultation around the tribal opioid response grant. I think the biggest outcome from that was we heard that the funding cycle that was 2 years was just too short. And so we were able to increase that funding cycle from 2 to 5 years on the 2024 notice of funding. Go ahead and go to the next slide, please. I wanted to just share briefly some resources that were available to SAMHSA around 988, partner toolkit to get the word out. We're very proud of this partnership, and the link to the Veterans Crisis Line, 988, press 1. Also, in the next few months, watch for some social media and awareness campaign that's been developed, and American Indian and Alaska Natives were included in that campaign. So I'm really excited about the information that will be coming from that campaign. Go ahead and go to the next slide. And lastly, I just wanted to share the OTAP website, or the Tribal Affairs website that's been created at SAMHSA. Previous, and Commander Myers had a huge influence on this. Our SAMHSA website, tribally, we didn't keep it well updated, and it was also very hard to access. So we've been trying to develop a one-stop shop for kind of everything tribal at SAMHSA. So it's there at your fingertips and easily navigable. Also, an opportunity to sign up for a news and events opportunity that will keep you up to date on all of SAMHSA's NOFOs, our resources, our funding. So I would encourage you to check that out. So the next part of our presentation is going to be about the modernization of the National Tribal Behavioral Health Agenda. And Commander Meyer is going to take it from here and share the work related to the National TBHA.
Thank you so much, Captain Hurd. Good afternoon, everyone. I'm excited for the opportunity to share with you today about the work we've done at SAMHSA to translate what began as an ask from our Tribal Technical Advisory Committee in 2014 to chart out tribal behavioral health priorities and identify culturally responsive strategies that are reflective of unique tribal needs and strengths. The National Tribal Behavioral Health Agenda is a 96-page document. It was released in 2016, and it is considered a foundational roadmap for tribal and federal behavioral health collaboration. I will briefly talk about the work that we've done to elevate the National Tribal Behavioral Health Agenda through the development of a website landing page, and then I will discuss how this site can be used to further highlight tribal priorities around behavioral health, improving access to timely information and resources, and help support a comprehensive approach for collaborative initiatives, an approach that is deeply rooted in tribal cultural wisdom. Next slide, please. The concept of the TBHA came from the SAMHSA Tribal Technical Advisory Committee and was driven forward by the HHS Secretary's Tribal Advisory Committee. Prior to the TBHA, there was no one single national program or document that brought together and elevated the importance of behavioral health for American Indian, Alaska Native people, and that identified priorities that were developed by tribal communities. We know that many individuals and organizations play a role in addressing behavioral health and their related programs, and their related programs at times are loosely connected through a broad landscape of tribal and federal projects, programs, initiatives, and funding streams that require better coordination to improve well-being. The idea of the TBHA was to create a platform to allow for tribal and federal collaborators to routinely examine funding, program, and policy priorities that best support opportunities to improve communication, align efforts, and make real and measurable improvements in behavioral health outcomes for American Indian and Alaska Natives. The TBHA document was a result of months of information gathering and discussing, analyzing, validating, sharing, and revalidating the input that was received from tribes, ensuring that tribal voices were honored in the development of the TBHA. SAMHSA, along with the Indian Health Service and the National Indian Health Board, shared information and facilitated these discussions and meetings with hundreds of tribes, tribal leaders, tribal administrators, tribal members, advocates for American Indian, Alaska Native Health, Native Youth, and other federal agency representatives. From the many meetings and discussions emerged a series of overlapping opportunities and priorities that serve as the framework for the TBHA. Originally released in 2016, a lot has happened since then. Of course, we've come out of the COVID-19 pandemic. We've also seen an emergence of higher potency synthetic opioids and other challenges in addressing behavioral health. These things impact mental health and substance use and the ways that we work together. So in recognizing this, our Tribal Technical Advisory Committee again called upon SAMHSA to update the Tribal Behavioral Health Agenda and ensure that it continues to be used as a tool for collaboration. Next slide, please. So yes, there are many new threats, challenges, new approaches to how we deliver care, but we often heard from tribes during our series of listening sessions that priorities had not really changed. Some of the things that we heard through our series of tribal listening sessions was that there was a gap in how people were accessing and using the information in the TBHA document. We learned that while some of the statistics used in the background and presenting the pressing need for better coordination and agency strategies, those things needed update. They were out of date, but the intent of the agenda and the priorities that had originally been identified in 2014 to 2016 were enduring. We also heard through our listening sessions about many new programs that were working across the priority areas, although they weren't directly connected in print to the TBHA. So the question became, how do you show that impact? How do you highlight successes and create more awareness and visibility into relevant and current initiatives and resources that are addressing the tribal priorities that are contained within the TBHA? So we went back to our Tribal Technical Advisory Committee with what we learned, and we came out with a new outlook on what an update might look like. The conversation and the approach shifted from updating in a document to how do you build off of the TBHA in a way that is responsive to how people interact online and how we search for information. The original intent was for the TBHA to be a platform for collaboration, but the platform for how this information was shared had not been updated. So this led to our development of the online landing page, which digitalizes the content and allows for updated links to be maintained, and overall lets users work within and with the TBHA in a way that was reflected in what we had heard from tribes. Next slide, please. This slide shows the components of the TBHA, or the 5 foundational elements. It's important to note that the TBHA is grounded by a cultural wisdom declaration, which was created by tribes. It defines the state of urgency and historical context while also providing information on tribal systems, key priorities, and the strategies that can be used to address those priorities, and also how we can collaborate across tribes, tribal organizations, and federal agencies to create responsive cross-cutting initiatives. The foundational elements of the TBHA are the factors identified by tribes that are contributing to or exacerbating behavioral health challenges in Indian country. Each foundational element includes priority areas that were gleaned from targeted conversations about these most pressing concerns. The priority areas contain strategies based on analysis of responses to questions related to desired outcomes, healthy communities, and stronger systems. One element, for example, that you'll see on your screen centers around national awareness and visibility. It really highlights the strength and self-determination of tribes to determine what programs they need and what they need, often data, to support those programs and initiatives. The strategies here are really focused on how the federal government can help support tribes in that space. Next slide, please. Now my slides, they'll get a little small because I shared screenshots from the website, and I'll put the link in the chat when I'm done. But everything you see here, don't try too hard to read because you can access it from your computer or your phone. And there's the link as well as the QR code to get right to it. But this is what the website actually looks like and a few ways to access it. You can see the original TBHA document on the bottom left of the page. It was very important that we maintained strong connection to the print TBHA, and it can be accessed in multiple places in the website and downloaded through the SAMHSA store. We also wanted to make sure that this website and the space incorporated the original artwork and color scheme of the TBHA. If anyone is familiar, it is a beautiful document that is very, very well done. And it's hard to really grasp that on a website, but we did our best to incorporate the color scheme that is in the original TBHA. And each section is directly connected right back to the document, and it allows someone visiting this website to easily click back and forth and access relevant areas of the TBHA. Next slide. And here are the main sections of the website. I'll spend a little time just walking through two of them in the next few slides, but I do want to point out that you can access information about the original contributors. We have a YouTube link on the contributors site, and you can really see how this came about. There's also updated and current strategic plans from across the government. That was a big part of the TBHA. It was crosswalking priorities with federal strategic plans, but plans change and are updated. So we have created a space where you can access the most recent version of agency strategic plans. And we also have a tribal data landing site here where we link you to resources across tribes and the government on accessing tribal data. And so next slide, please. So this is one area of what we saw in the prior slide. It's the historical and current context section of the website. I really wanted to highlight it here because this is one place where you can go and find a wealth of resources. It was a very critical part of the print version of the TBHA, and we have federal initiatives, resources, funding, and programs, and how they align. This is where we can continually update, and one of the most important elements of the online version, it allows us to keep the TBHA current, to date, and also to help find where the alignments are happening. There are a wealth of cross-cutting resources located here to support a number of behavioral health areas and healthcare and supportive service considerations. And we're able to add things all the time. So if you come across a resource or you have a program that aligns, we're able to add a link here and increase access in this spot. Next slide, please. And it gets even busier here. But again, we condensed a 96-page document with so much, a wealth of information into this website. And this is how we did it. So this is the priorities for collaboration, and it's where you'll find the roadmap for addressing the gaps in services and identifying areas and opportunities for improvement. And these areas were prioritized and strategically identified by tribes. And this helps us look at how we're working under these priority areas. You'll find the foundational elements, the priorities, and the strategies mapped out in a way that's clickable and easy to navigate and really find what the tribal priority is and what is the work that we're doing with tribes to help support these priorities. Next slide, please. And finally, the TBHA, it really is a roadmap where we can align our work with the priorities of tribes. It's not an end. It was built on existing relationships and pathways, and it helps us continue to build the path forward. We have to continue to identify ways to update resources and links, and through meaningful collaboration, help measure progress in these areas together. And the website hopefully is one way where we can work more collaboratively to reach our goals. So, thank you very much.
Thank you very much for that. Very informative. I think we're doing okay on time here, so I just wanted to see if I could maybe grease the wheels with questions. Just a couple quick questions for you and your slides. Maybe it's a very heavy topic and things. One of your bullet points on your slides noted that there's an increasing rates of substance abuse disorder, overdose, and suicide. Can you just maybe shed some light on that? What the findings are, what you're seeing out there as far as the root causes of that, things along those lines. And this is for the larger group as well. Just a reminder to ask any questions through the Q&A module here at the bottom of your screen. There's a Q&A tab there. Just drop any questions you have in there, and we will make sure that our presenters get those questions. But so I'll give you two questions, and I'll let you guys answer them. One was about, maybe what are the findings? What are the latest data and research showing as far as root causes of the increases in substance abuse disorder, overdose, and suicide? And then one was about, as you put this TBHA together, what's your experience been collaborating across government entities to get the most accurate data that you can? And I selfishly ask that because we're trying to create something of this nature for our veterans to be able to gather some kind of hub of information, of funding sources, and of the updates. So I'm very interested to hear, because I've gotten a couple presentations from VA already, and they have different data collection agencies within the VA itself, and they don't necessarily talk to each other. So I'm always curious about how that part of it goes for anybody doing it successful. So I'll turn it over to our presenters to answer those two questions, if you don't mind.
I can start and definitely defer to Captain Hurd. I think one thing we found in reviewing the statistics for the TBHA update, that there was definitely challenges related to the COVID-19 pandemic, as well as higher potency and synthetic opioids that lead to increase in overdose rates. But I'll let Captain Hurd speak more to that, and I'd love to come back and address the second topic as well.
So I'll just share related to opioid overdose. We've heard from spring to summer, we engage in regional tribal consultation with each of the HHS regions. So recently, I've been to Region 10 and Region 9. We've engaged with Region 1, and we have Region 2 upcoming. I might have Region 2 and 1, cross those out. Anyway, unfortunately, we've heard consistently about an increasing availability of synthetic opioids, particularly fentanyl, and how that is fueling increasing overdoses. We've also heard that there's just like a lot of need, right? And a lot of gaps related to social determinants of health. So lack of housing, lack of access to all of those kind of determinants of health that create like a healthy person, a healthy family. So how are we addressing that? I also, before I hand it back to Jenna, I'll talk about the data. I think that's difficult, right? And a lot of tribes are talking about, like how do we gather like our own data? The data that you have doesn't reflect the data that we have. So, how do we come together on that? With the Tribal Opioid Response Grant, we were directed in the 2023 statutory guidance to create a needs-based supplement for funding related to those communities with the highest opioid overdose mortality. And so we worked closely with CDC to figure out how we would do that. And, unfortunately, we defaulted back to county data, and with American and Alaska Native, figured into that data. So, and it wasn't the best, right? But it's what we had available. And so I think that really kind of shed a light for me about how we have a lot of work to do related to how we're collecting that data, and then how we're testing that data against what the tribe's data is and what their experience is. So I'll stop there, Jenna.
So I definitely agree with everything Captain Hurd said. And to add on, the relationship and networking aspect of the TBHA that was started many years before I came to SAMHSA is one of the strengths that allows us to be able to start to collect the information in a hub space. There, you'll see on the contributors space how many people, organizations, and agencies were involved in coming together to create a collaboration foundational work. And I think that just building upon that has been so important. And the hub having the links and the resources brought all together so they're easily accessible, that can be difficult because there are so many, and it's hard to even know what's out there. There's several layers sometimes even within agencies to find specific data that might be useful. But when we can put them together, then we can also start to see the gaps. So we can see what's missing easier. So creating the access, sometimes it is a lot of just doing digging online and getting deeper and deeper and trying to find any point of access. And if there, what are the resources that exist around that? But there needs to be that space where you can have, I don't want to say just like a one look, and it's not, it's the start. But is that helpful? Did I answer?
Yeah, it is helpful. What it sounds like is you also have the challenge, right? It is a challenge for you all to do that, but at least you have a starting point, right? Which is a lot of places don't even have that hub to go in and collaborate quite yet. So I made mental note for myself. Some of the things we need to do for our veteran population specifically is to create this type of a hub, and it takes a lot of collaboration. So you guys sound like you have, a very good working model for others to emulate and to work from within. So I really appreciate the help that you all are doing on that front. I do have a question from one of our participants. We'll go to that question. And this question is phrased in general, how accepting are the different tribes to behavioral health services? For any of our presenters there.
So I would not presume to speak for any tribal nation or other tribal citizen. I will say though that a good majority of tribes have compacted and contracted their dollars from Indian Health Service, right, to run their own health systems. And so I used to the director of behavioral health for Choctaw Nation, and kind of building and being able to staff like our own health systems with our own tribal providers, being able to incorporate, our culture, really helped our tribal citizens seek services from our behavioral health program. But I think, there's a lot of work to do related to that. We also know that the majority of American Indian Alaska Natives reside in urban areas. And so how are we ensuring that there's behavioral health services in urban areas, that are welcoming and, culturally kind of relevant for our citizens that live in urban areas as well. So, I do think, when tribes are able to exercise their tribal sovereignty and be able to, have dollars, that are flexible and that they can use in the way that they best serve their community, I think that's when folks are able to access services, that resonate with them, and they feel comfortable accessing.
Thank you for that. Commander Meyer, did you have anything to add at all on that one?
I don't, thank you.
Okay, you got it. Well, that's all the questions that we had right now in the Q&A. I just want to thank you both for the work that you're doing out there and for creating these pathways for folks to go and collaborate, get information. It's hard enough. We're in the information age, right, where it's almost too much information right now. It's good to have it, but it's even better when somebody else curates that and puts it in a way that's easily digestible. So I commend you all for the work that you are doing. I know your roles are much larger than that. So very much thank you for the work you're doing now and that you continue. And you've got a thank you coming from the audience as well. So I just want to extend that out to you as well. Just going to give it one more minute here before we move on, but yeah, I'm going to go ahead and introduce our next presenter, who is Sienna Hunter Sujay, who is the Director of Office, Tribal Affairs and Policy at SAMHSA. I'm sorry, wrong line. I gave you a promotion. She is going to present on the Tribal Training and Technical Assistance Center for Department of Veterans Affairs. Sienna, I will turn it over to you. Thank you.
Awesome. So good afternoon, everyone. I like to start with this slide, particularly when I'm speaking with an audience that works with military and veteran communities, families, individuals, because part of the work that we do at the center is asset mapping and identifying, the resources in your community, connecting you with resources, and that's all about sustainability and leveraging your resources. So I always like to utilize this slide because this is the Native American Women Warriors Association, and so they do some pretty amazing work across the country, particularly in the field of female veterans in military service. We can go to the next slide. So, hi. Oops. And you can go next slide. And we did a disclaimer earlier, so this is just my disclaimer from the center about the views expressed in this webinar do not necessarily represent the views, policies, and positions of the Center for Mental Health Services, the Center for Substance Abuse Prevention, the Substance Abuse Mental Health Services Administration, or the U.S. Department of Health and Human Services. So the next slide. And Hakame is welcome in my traditional language. And we kind of got a gist of what I have been doing and the work that I've been doing for 20 plus years in the community, both locally and nationally. And we can go to the next slide. All this information will be provided, so we don't need to sit with this slide for too long, but these are the primary contacts for the center. And we can go to the next slide. So I just wanted to make sure that stepping away from this today from me, that it might have increased a little bit of your cultural understanding, and then also give you a better awareness of what we do at the center. Next slide. And I really wanted to make a point that I sat with this for a moment with you all to talk about the historical trauma for Indigenous people. I'm not going to go into a whole historical timeline of things, but I wanted to make note of these 6 key points for our tribal communities, that, some of the things that we are seeing present day are a result of the loss of land, the loss of culture, the loss of community structure, the loss of family structure, the loss of identity, and then also, our indigenous spirituality. And I mention these things because it kind of frames the work that we do at the center, knowing that our communities have experienced these losses, have experienced this trauma. And some of it has come through the boarding school era, and some of it currently still happens. I would be amiss if I didn't note that June of this year marked 100 years the U.S. government granted U.S. citizenship to the indigenous peoples of this land. And so in my lifetime, that means that my grandparents did not actually have citizenship here, even though they were born here for generations. And for their service papers, it would list them as alien friendly to the United States. So all this is still very contemporary for the communities that we work and live in regards to trauma. And so that's really important for us in the work that we do at the center, that we focus our lens on the resiliency and not sit with all the harm and the hurt that has happened in our communities. We can go to the next slide. So these are some of the key objectives that we have, that we do provide culturally appropriate training and technical assistance for American Indian and Alaska Native communities. And this is in the area of substance abuse, suicide prevention, and mental health. As mentioned before, there is the Tribal Action Plan, so we do provide assistance for communities. The Tribal Action Plan is under the Tribal Law and Order Act, TOLOA, Indian alcohol and substance abuse. And we support communities in the development of that. We work with SAMHSA grantees and others. We collaboratively leverage resources, and we try to help increase protective factors for our American Indian Alaska Native communities. Next slide. So this is our theoretical framework. We have the assessment piece. We do a community readiness assessment. That's kind of a low-tech way to gather data and information for a community that's not overwhelming. We work on capacity building. We do a lot of planning, and we support the community implementation. Throughout all of that, we do evaluations because it's important to know if we are being effective within the community. And we are always keeping in mind our all-encompassing piece is the cultural competency and the sustainability. We want to be able to provide tools and resources to the community so then they can continue the work themselves. Building that capacity is huge. Next slide, please. So these are, sorry, our 911 system is down in the area, so my phone keeps going off. So we have 4 areas that we do the prevention work. So our broad is kind of like anybody. So anyone who's working with a tribal, indigenous, American Indian, Alaska Native community can put in a request to have some support. It can be a tribal community that does not have current SAMHSA funding. And so that is really kind of our big catch area. I spend a lot of time with the board. And then we have focused, and those are tribal communities like Native Connections that have a funded grant, and part of their work through Native Connections is doing specific trainings, which I will go into what those are in a moment. And then intensive, I also spend another portion of my time with intensive communities, and that's an opportunity for us to work with a community. They do not have to be a federally recognized tribe. They could be state recognized. They could be a tribal organization. We spend an intense year getting them services in a sense of doing assessments, being able to create a prevention plan for their community to address mental health, substance abuse, suicide prevention. And then a tribal action plan is another piece. And this is where, communities have the opportunity to create a strategic plan that guides the discussion and, what the community is saying they need to address substance abuse and mental health. That's a big thing. And I think tribal action plans are not utilized enough by our tribal communities. And so I'm always promoting those a little bit more as well. Next slide. So these are some of the curriculums and trainings that we are able to provide with our staff. The staff at the center is predominantly Native American, Alaskan Native folks, which is also really unique and wonderful. And I know someone had asked a question about, how receptive are some of these communities for services. I think the fact that we have tribal folks that are going into tribal communities helps us a lot in being able to gain trust and understanding and coming from a place, a good place. We do a lot of work with the Gathering of Native Americans GONA or the GOAM. So we could not only facilitate these events, but we could also train facilitators. We do mental health first aid, we do assist, we do QPR, we do the just general substance misuse prevention training. I mentioned before the community readiness assessment, strategic planning, asset mapping. We do support a lot of social marketing, social media work. We have lots of templates that are available to communities so they don't have to recreate anything. And that is always helpful to our communities. Next slide. So going back to my first slide about the historical traumas and being effective in our TA is that we really want to empower our communities. So we really try to make a point that the work that we do is community-driven planning, and that, the concerns and the decisions about how they're going to address the needs of the community is coming from the community. Cultural competency is a huge piece. Even though we are tribal folks, we come from different regions around the world, and we make an effort to speak to leadership, whether it's elected or kind of your general leadership, known leaders in the community, about what's appropriate. And we always have those conversations before we come into the communities, like who do we address? What's the right way to move in a space? Are there any particular local traditional medicines that are used? How do you open up your meetings? So we always have those conversations before we go on site to the communities. We're looking to build partnerships and collaboration, and that's really so big in our asset mapping because we are building that capacity. We are flexible in our teaching styles. We do meet the community and their needs and where they're at. A lot of us happen to be social workers or in the mental health field, and so some of that is one of our core trainings. And then always trauma-informed. We do recognize that the subject matters that we are having and the conversations are heavy. And part of our planning process is, do we have someone in the room that could, sit with someone if they feel triggered? During our GONAs, we have a spirit room, or sometimes it's called something else, a quiet room, safe space, where there are the local traditional medicines that people could sit with so they could be reflective to come down if they are triggered in those moments. And so we find that these 5 points are really helpful in being effective in our TA. Next slide. And then these are some of the examples of the evidence-based work that we do: cultural-based interventions, more of the public community-based interventions. So the QPR training, the assist training, mental and mental health first aid training. And then looking at our culture. Culture is so big, and making sure that traditional language is incorporated, our stories, our songs, our prayers, supporting cultural camps and traditional kinships and relationship systems. We want to always elevate those because we find that that has the most success in our communities, and that helps people feel connected. And going back again to the historical trauma, like how are we connecting people back to their community, back to their language, back to their land, back to their kinship. And it's really important for us to support these cultural-based interventions. And then also looking at public interventions and just general interventions for community, and how can we incorporate things that are already happening. We don't have to reinvent anything. We don't have to burden people anymore, because a lot of our communities are stretched thin. And so we want to support and elevate what currently exists there. Next slide. So even though, we have this historical trauma, we really like to focus on the resiliency of the community, and look at culture as prevention and culture as resiliency. And so that is important for our youth, and being able to have our youth engaged, particularly with the suicides that exist. What do we have them to connect with? How do they have a sense of community? And we could do that through culture. Next slide, please. So I had mentioned the GONA, or the GOAN, and you could go to the next slide. So the GONA, again, this is a cultural-based planning process where members have the opportunity to get together and speak on what the needs are. What are the issues? What do we need to strengthen in our community? It's interactive. It's definitely an event that is, part of a bigger piece of what the community is doing. It does reflect cultural values, traditions, and practices. This was developed by Native folks for Native folks. And we get a next slide. The GONA it used to be 4 days, and so each day had a theme, but with COVID and some changes, we've kind of condensed it now. So it's really 3 days that we're on site. And so the first day is belonging. And this is really probably the most important day, is so everyone feels like they're safe in this space, in this environment that's being created, for everyone to be able to share what the concerns are, or share about, what is happening really well in the community. And so it's a welcoming space. Over the course of the GONA, we have we'll make sure that the community is selecting speakers to speak on the different themes. Very often they're elders. Sometimes they are youth, which is wonderful to hear from the youth, or elders in training, as one of my colleagues will refer to them as. Mastery is our second theme. And this is where, it could be a very difficult, heavy day, because we are talking about the historical trauma and the impacts that it has had in the community. But we also don't want to sit in it. We want to be able to acknowledge the strengths and the resiliency of the community. Some communities struggle with having conversations about the trauma and the historical aspects of things. And sometimes we aren't able to sit in that space, but we really will talk about the resiliency and the strengths. Third theme is interdependence. This really initiates the planning process with the community. We're looking at resources, relationships, the interconnectedness across the community, and how can we bring our elders and our youth together? How can we bring our leaders together with the community, and so everyone feels heard and seen? And throughout the GONA process, we have people take time to engage in some of their traditional activities, like basket making, beading, whatever it may be, through the course of the GONA. So then on the final day, everyone is able to receive a gift. And it really kind of, again, connects people. And sharing and giving a gift really symbolizes the importance and the significance the person has. And so they feel part of the community. Gonas are really wonderful. A lot of healing happens in Gonas, and it's probably one of our biggest requests that we have at the center are Gonas. Next slide. We spent a lot of time supporting 988 in the very beginning, and our team was able to develop tools and social media stuff. And so we have images and everything that are kind of regional based. So the designs look different, the coloring looks different. So some of the Navajo, that region, we have more of a turquoise color and pottery design. This is more of like a Northeast Ojibwe kind of Anishinaabe design. And so it was really nice to be able to work on this particular project to help support the communities initially as 988 was launching. Next slide. And again, we do continue to support the 988 work, and some of the things that we do recommend when communities need the support is the QPR training, the ASSIST training, mental health first aid, and also Safe Talk. So those 4 trainings are ones that we recommend for communities to help navigate some of the 988 stuff. Next slide. And then one of the other things that we have been working on is creating safe spaces to heal, because we do realize that our healers need space to heal too. And so how do we address grief in our communities, and how do we support this better? And I do have a video on the next slide. I don't know if we'll play, I hope we'll play. It's not super long, but I think it gives a better rundown of what the Creating Safe Spaces to Heal can be. So it's not really a curriculum, it's just a guide that could support our communities.
Sienna, I am sharing this this slide deck, and I did not enable the sound. I didn't realize there was a video.
Okay.
So let me stop.
No problem.
Sharing
So,
back up. So just hold on. So just
Yep.
share. Stop sharing. Then I'll reshare it.
Awesome. Thank you. As you're doing that, I will also speak about digital storytelling. And so that's a big thing that we do at the center as well, collecting our stories. And that's a great way to integrate and bring together our elders and our youth is in storytelling. So we do support digital storytelling.
Right, the video is ready. If you are ready.
With life comes loss. With loss comes grief and bereavement. SAMHSA's Tribal Training and Technical Assistance Center and Tribal Tech LLC have developed a guide called Creating Safe Spaces to Heal. This guide will help you design and implement strategies that are specific to your culture and community.
Each unit will consist of one or more mini-teaches on different aspects of loss and bereavement, followed by activities to implement in the community. Throughout the guide, we have included videos of traditional stories related to loss, bereavement, and healing. In Unit 1, we listen to the voices of elders as they talk about lessons learned from traditional practice. We consider the relational aspects of grief and different types of losses that can cause grief. We also look at a video of a traditional story about loss and the grief journey. Prompts for group discussion follow the video. Unit 2 looks at how historical trauma can impact the grief process. It considers the different ways that trauma can impact healing, and then looks at resilience and activities that encourage resilience. Unit 3 presents mini teaches on types of grief, stages of grief, and the role support plays in healing from grief. It also looks at ways to help those grieving a suicide, as well as the role of social media in the grief process. Unit 4 examines the path forward as the bereaved adjust to life beyond the loss. It starts with a video about a traditional giveaway. Next, we introduce a model of how people cope with bereavement. We then provide support system activities. The grief journey is unique to each individual and every community. This guide presents ideas and resources for you to use in helping people on this journey. Choose the stories, tools, and models that fit your plans and tailor them to your culture and community. We hope that you find this guide helpful.
Next up, an episode of Heartland. Oh, all right. Maybe next time. It's a good show. I watched that.
That is all I have. And so I'm open to questions when you all are ready. Thank you.
Thank you, Sienna, for that. So much good information. I have several questions, but I want to get to our participants first. Let me see here. We have a question. Where'd that go? Okay, so the question comes in as, is it appropriate culturally for non-native providers to attend a GONA training?
So yes, but it's up to the community on who they open the GONA up to. I will say that the GONAs that I have participated in, supported and facilitated, that they had anyone who maybe like worked in their community or worked with their community to be able to engage. And it does depend on the community and who they invite. So it can be appropriate.
So I would say, you know, just like anything, right? Relationships are everything. So if you are interested and participating, make contact with the tribe or the community that you're interested in, with the leadership that does this stuff. Introduce yourself, you know, express your intent would be good way to start if you don't have any of those inroads. But if you have those inroads, like I said, everything's about relationships. So that's just a little bit of encouragement I would give you on that front. And any of our presenters can also comment on that. One other question was for providing, can you provide the link to the materials for the grief work? Are there materials specifically for the grief work part of that, Sienna?
Yes. We usually have folks put a request in with the center for their materials, and then it could be sent out to you. So let me get the link for the TA Center, and I will drop that in there.
Yeah. So some of the discussion was, you talked about QPR, mental health first aid, and things of that nature. Are there fees that offer that? Are those things, are there grants, or how do people access those types of trainings and presentations?
So again, if you put in a request with the center, what we can do is we are able to provide some of these services directly to a community without there being a cost. But very often it's like a sharing cost that is involved. And so our labor time is able to be covered on that. Sometimes we're able to get consultants in if our team is not available. We have an amazing group of consultants that work with us. And so put the request in if anyone needs the support. you could go ahead and, fill something out. What happens is that you do an intake process with one of my coworkers, and then we review the request, and then we could see how we could support that request. Sometimes it's an individual that goes out. Sometimes it's a group of us that goes out. It could be virtually or in person, but very often it's no or shared cost to a community.
And a lot of this discussion and things are surrounded around basically a strategic planning format. So as part of the TA to develop that strategic plan, and then from that, is there a timeline involved with taking the strategic plan and reviewing that on an annual basis every couple of years, or is there a cadence to that the TA Center helps establish with the communities they do the strategic plans with?
So we, unless we're directly working with a community, like in Native Connections or Intensive, we go in, we provide the TA and work. We do have a follow-up that happens like 6 months later. Do we do a check-in? Otherwise, that's kind of like our timeline. We do recommend folks, like their tribal action plan, that it needs to be a living document, and you gotta be utilizing it all the time. Bring it to, the meetings. If it's a health committee meeting, bring it to health committee meeting, have that tribal action plan ready and run through it. Like, are we hitting the key points here? Are we meeting the needs of the community, and referring back to the document? So we always encourage our communities to utilize their action plans, their strategic plans, as a living document. That don't create it and put it on a shelf. Make sure it stays right on your desk and it's going to every meeting, and you're referencing it. And so we do encourage that.
Thank you. Got another question that just came in. Does your staff work remotely and come together as needed?
Yes. We do work remotely. I think we're kind of, we are very much region-based. I think I'm the only person who's in the Northeast, and then there's a few folks that are in the Southeast. A lot of people are in the South or the Northwest area. So we do have opportunities that we were able to come together, but we all work remotely.
Got it. Are there any SAMHSA local offices people can work with, or regional offices, things like that?
Yes. And, we always encourage to touch base with your local SAMHSA, your local IHS. There's other organizations like USET that helps collaborate. There's Southern and Eastern tribes. And so that's always nice. But we always like to, connect people with their community resources, because that only strengthens the opportunities that exist for folks.
Okay, somebody's shooting their shot right now and asking are you hiring?
We always are hiring. So the center is made up of 3 different companies. The primary company is 3-Star. This other company is Tribal Tech, and then Wolfia. So if you're interested in doing the work, always look at the governmentjobs.com. We want to make sure that, we're bringing the best folks forward. So, yeah.
Companies, you listed 3 companies, right? So those companies essentially have government contracts, right? They're on a government contract. Is what you're saying?
So 3-Star is the primary on the contract, and then our subcontractees are Wolfia and Tribal Tech.
Got it. Okay. And Captain Hurd put a link in the chat for regional office contacts as well. So that's in there, and a map. Okay, perfect. All right, we had a little barrage there of questions. Anybody else have any questions for Sienna and or our other presenters for that matter? That's what we had for the presentation today as far as slides are concerned, but certainly have a little time left for any questions or comments for our presenters while we have them. Oh, here we go now. We've got an attendee asking, is the Creating Safe Spaces to Heal guide on the SAMHSA TTAC website? I think that's going to be one for Sienna.
Yes. I don't know if it's currently up on the website. Again, if you submit a request to the center asking about that and asking about possible training and resources for it, then someone will get back to you pretty quickly. We have a pretty quick turnaround. We try to get to folks within like 1 to 2 business days in responses. I know it's, again, there's been restructuring of the website. So I know that, part of ours is being updated as well.
You bet. Okay, well, thank you for that, Sienna. We've got another one. Oh, no, just a thank you. Thank you. This was a great comment. So thank you for that. And then I guess we can go to our next slide. So I just want to make sure we plug our upcoming series, Honoring Traditions and Cultural Practices in Healing. We're going to have Tuesday, August 6th, 2 to 3:30 p.m. Eastern. The session will illustrate the power of traditions and cultural practices in healing. For example, many communities hold ceremonies when service members leave for their service and again when they return. Practices like sweat lodge, talking circles, honor songs, and drumming all work to heal the mind, body, and soul. We will have Barbara Aragon, Laguna, Pueblo, and Crow, Technical Assistant, SAMHSA's Tribal Technical Assistance Center, Raymond Daw, Navajo Nation, Behavioral Health Consultant, National Association of Behavioral Health Consultants, and my buddy, Ivan Sam of the Navajo Nation. He's a cultural ambassador, and he does a lot of really great work with the Veterans Art Project in Southern California. Let me see here. We've got some activity in the chat with some links. Oh, there you go. A comment from Sienna. Barbara is one of her trainers in Creating Safe Spaces to Heal. There's connections there. And then Dwayne has put a link in the chat as well for that upcoming event. And Stacy Owens, thanks, Carrie, Jenna, Sienna, and Dean. This was great. And we have a couple more comments. Just say thank you again. This has been great information. Hoping I can use this somehow over here in Oahu. Well, thank you for tuning in from Oahu. Really appreciate it. We're gonna leave some contact information up on the slide right here for anybody to capture that. But also you will get the slides as well. And I am just combing the chat one more time. Make sure we got everything. I think we do. Well, here comes another one. Lots of thanks coming in. Oneida Nation represented. Thank you from Oneida, Wisconsin. All right, folks. Well, Captain Hurd, Commander Meyer, Sienna, Hunter, Sujay, you guys were great. Thank you for the great work that you all are doing out there. This is really critical, important work. I learned a lot myself. So I hope to apply a lot of what you all are doing into our veterans community and our veterans spaces to create those hubs of information and information dissemination. So keep up the great work out there, and look forward to working with you all in the future. Thanks, everybody. Have a great day.